All right. Good morning, almost afternoon, everyone. Thank you so much for joining us today for this webinar, Connections Between Criminal Justice and Health, Social Drivers of Violent Crime. My name's Haley Aka. I'm Vice President of Operations and Strategy at HPIO, and we are so glad that you all are here with us today. HPIO is an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. I want to take just a minute to thank our core funders who advance our mission with their steadfast investment in our work. A special shout out to the Ohio Center for Excellence for Behavioral Health Prevention and Promotion. They are our educational event presenting sponsor this year. And on the next slide, we'll see the rest of our 2024 educational event series sponsors. Thank you so much for your generous support of these events. We're going to have a little time today for Q&A at the end of our webinar. So as our speakers are presenting and your questions are coming to you, please feel free, drop anything you've got into the chat box or the Q&A box, and we will address those as time permits. We're also going to have some poll questions at the very end of our event today, so we hope you'll stick around for those. Today's presentation slides and other resources related to the presentations are going to be available on our website. You can head to hpio.net and click on the events tab for anything you might need there. Here's our agenda for the hour we're going to spend together today. We're going to start with a presentation from our team at HPIO on our brief on the upstream drivers of violent crime. We're then going to hear from partners at the Ohio Domestic Violence Network and the Lorain County Urban League about programs that they're implementing to prevent violence. As our presenters share today, please keep in mind the many ways that you, as either a private citizen or a representative of your organization, have the ability to educate policymakers and influence the policymaking process. We're going to think a little bit more about that at the very end of our time together today. So to kick us off, I am very happy to introduce my colleague, Dr. Toni Oberle. She's Senior Policy Analyst at HPIO and lead author on this work, and she's going to walk us through the findings and policy options from this latest brief. Take it away, Toni.
Great. Thank you so much, Haley, and good morning, everyone. It's great to be with you all today. Again, my name is Toni Oberle, and I'm Senior Policy Analyst here at HPIO. So we'll start here with this pie chart that describes the modifiable factors that influence our health. When we think about improving our health, we often think about access to clinical care and the quality of our health care, which actually makes up about 20% of the influence on our health. A lot of people also think about our health behaviors, which is how we treat our bodies, how we eat, how we move, and that represents 30% of the modifiable factors on our health. Research shows that in the dark blue section, 50% of our health is influenced by our social, economic, and physical environment. These are the conditions of our communities, from housing or transportation, employment opportunities, as well as experiences that we may have with the criminal justice system. In order to improve health, we need to pay attention to all of these factors, including the communities we live in and the policy systems and structures that give people a fair chance at a healthy life. This brief is organized using the social ecological model, which shows how various levels of society impact health and are interrelated. While all levels of the social ecological model are relevant to violence prevention, this brief focuses on the community and societal levels and therefore highlights how social norms, collective efficacy, systems, and structures contribute to violent crime. While this brief does not focus on individual level factors, including mental health status, other HPIO briefs, including the ACEs or Adverse Childhood Experiences Impact Project series, are a great resource for this topic. Over the past 3 years, HPIO has produced 5 briefs on the connections between criminal justice and health. This current brief takes an upstream approach and highlights research on how community conditions, systems, and structures impact violent crime. The three key findings of the brief are that community conditions can perpetuate or prevent violence. Violence is a public health problem and impacts the physical and mental health of individuals and communities. And finally, that there are evidence-informed policy solutions to improve community conditions, prevent violence, and improve community health and safety. I wanted to start with some data to ground us in this brief. Here you see the count of Ohio homicides by year. Notably, homicides peaked during the pandemic, which was a time of upheaval and instability, but have not returned to pre-pandemic levels. Our policy brief summarizes research on structures and systems that drive violent crime. I'll summarize the structures described in the brief first. Research shows that structures including racism, income inequality, zoning and neighborhood planning, and gender-related social norms contribute to violence. Importantly, there are many additional forms of discrimination not discussed in this brief, including ableism, ageism, xenophobia, homophobia, and transphobia that impact violence. These forms of discrimination are intersectional and interact with each other as well as those discussed in the brief. And I'll go through a couple of these just for examples. So here's a simple pathway describing how racism contributes to violent crime. Historical and ongoing policies and practices have resulted in poor community stability, lower home valuations, increased foreclosures, and limited economic mobility in majority Black, Hispanic, and Asian neighborhoods. As a result, many of these communities experience concentrated disadvantage, which includes limited educational and employment opportunities and higher rates of poverty, unemployment, and food insecurity that continue today. Research shows that concentrated disadvantage is associated with higher rates of violent crime. Income inequality occurs when income is unevenly distributed across a population. The United States has one of the highest levels of income inequality of any Western country, and income inequality continues to grow. Ohio ranks 30th out of 50 states and DC on income inequality, resulting in large disparities in community living standards across the state. Research shows that increases in income support, such as earned income tax credits, increases to the state minimum wage, and public spending on SNAP lead to reduced violence. Next, I'll highlight systems that drive violent crime. The brief highlights research explaining how access to quality education and employment, healthcare, including mental health care, and affordable and safe housing are preventative for violent crime. Additionally, the brief highlights data on the mixed impact of the criminal justice system and policing, which I will discuss in more detail shortly. So first, let's talk about healthcare and violent crime. Access to healthcare is related to the perpetuation or prevention of violence. For example, people who are uninsured or underinsured are more likely to experience injury from violence. Mental illness is often erroneously seen as a cause of crime, when in fact, research shows that people experiencing mental health crises are more often victims of violence, which we could even note in relevant news today. On the other hand, access to quality health care can also prevent crime. For example, increased healthcare access associated with the Affordable Care Act Medicaid expansion has been shown to reduce violent crime by improving financial security and increasing access to treatment for behavioral health and substance use disorders. Yes, Sonia Massey, say her name, agreed. The criminal justice system, so the policies and practices of the criminal justice system have an impact on community violence. For example, there is evidence that additional police officers reduce violent crime in a community. However, increased police presence through over-policing can have a negative impact on community safety, such as through increased negative interactions with police, including police use of force. In 2023, 42% of Ohioans who experienced police use of force were Black, and Black Ohioans experienced police use of force at over 5 times the rate of white and Hispanic Ohioans, as displayed on the screen. So what can be done? There are evidence-informed policy and program solutions that can be leveraged by the public and private sectors to improve community conditions and prevent violence. Policymakers can support violence prevention interventions that build positive social norms, including active bystanders, violence interrupters, mentorship programs, and restorative justice programs. Taking an upstream approach and addressing community conditions is crucial for violence prevention. Addressing community conditions requires a holistic approach. Evidence supports policies addressing housing affordability, quality education and employment, criminal justice reform, child care subsidies, and reductions in alcohol access as preventative for violence. In 2022, 80% of homicides in Ohio were completed with firearms. Policymakers can adopt scientifically supported gun policies, including child access prevention laws and firearm licensing laws. And as a final category, we have policy recommendations for eliminating racism and discrimination. As racism and discrimination undergird inequities and violence, a holistic approach to addressing racism and discrimination includes building partnerships, tailoring policies and programs to meet community needs, funding and implementing policies and programs that promote justice, and maintaining accountability. As a reminder, you can download and view our full policy brief, Criminal Justice and Health, the Social Drivers of Violent Crime, on our website here. And I think I have time to maybe address questions. Jasmine, if you can help me on time management, that would be great for that. Thank you again.
Yeah, I think you're good, Tony, for a couple minutes, if you want to see the chat.
If you have any questions, feel free to put them in the chat. Are there examples of effective programs you'd recommend receive additional funding? So there are, for this brief, it's such a broad upstream prevention lens that there's a lot of programs and policies that would fit into these categories. So really any evidence-informed, evidence-based policy or program that's addressing or aligning with these policy recommendations would be in alignment with this brief.
We do have several examples noted in the brief itself and linked in there for more information. So I'll go ahead and drop the link to our brief in the chat so you all can take a look at that as well.
Thanks, Ailey. And I do see another question, will violence decrease with youth intervention? I certainly think that supporting our youth is very important, and we do also have recommendations around mentorship, which often focuses on youth, and you'll hear more from our presenters today about how they're doing such great work supporting our communities. So let's go ahead and keep going forward so that we get as much time to hear from folks on the ground doing the work of violence prevention. So first, I'm pleased to introduce Lisa DeGeeter and Glenn Harris from the Ohio Domestic Violence Network. Lisa is the Director of Systems Advocacy and Policy Council for the Ohio Domestic Violence Network. Prior to attending law school, Lisa worked on sexual and severe physical abuse cases as an advocate at a rape crisis program and as a case manager at a children's advocacy center in suburban Chicago. After law school, Lisa was the assistant director of the Ohio Task Force on Family Law and Children, addressing parenting time issues. Lisa brings extensive experience in child advocacy. Glenn is the Director of Prevention and is responsible for gender-based violence prevention, training, and support. His work is geared toward creating and supporting communities where all people can live free of violence within their relationships and establish healthier definitions of masculinity and healthier gender norms to reduce all forms of violence. Glenn's primary role is engaging men throughout Ohio as he leads the Ohio Men's Action Network, or OMAN. In this role, Glenn has created the Know Better, Do Better, Be Better Ohio Healthy Masculinity campaign and facilitates various courageous conversations with men and boys across Ohio. So thank you so much to Lisa and Glenn for being here, and I'll turn it over to you.
Well, thank you so much for having us. We can hop on to the next slide. We are very happy to be here. And so we want to start with a little bit of the background of the work that ODVN does, because most of the prevention work we do is funded through the CDC. So it's definitely using the social ecological model of prevention. And we're specifically using a funding type called Delta. Which is a little bit of a tortured analogy, or not analogy, but acronym, Domestic Violence Prevention, Enhancement, and Leadership Through Alliances. Delta actually has a meaning, and it's been around for a little more than 20 years. There was a Delta project that became Delta Prep, Delta Focus, Delta Impact. I suspect many folks on this call are folks who write or work on grants, and so these tend to be 3-year funding cycles or 5-year funding cycles at different points in time. Currently, we're on a 5-year cycle to do work that continues to shift what we are focusing on, because we were really, what the CDC was trying to do throughout all the iterations of Delta was build the evidence base. People talk about evidence-based prevention strategies, and in order to select one to enact, the evidence base has to be built. And so what we're doing right now is the project called Delta Ahead. And Ahead is also an acronym, Advancing Health Equity Through Addressing Disparities. And I believe Haley said everyone is going to get the materials at the end. So anything that's a link can take you to the CDC's website or any of the websites that have information. But the other thing we wanted to let folks know is it's not just intimate partner violence that this work happens through. Delta is focused on intimate partner violence, domestic violence, but they do work around child abuse prevention, ACEs, adverse childhood experiences, the abuse of older persons, youth violence, community violence, firearm violence, and the rape prevention education program as well that works through sexual violence and rape crisis programs throughout the state. So let's take a peek at the next slide.
So here you will find a list of some of the past work we've done through the CDC Delta project, including some of our reports from those past project periods that Lisa just mentioned. So if you want to look at our website, odvn.org, you can find some of these reports. And what you will find is that the work has centered around what the CDC calls programs and policies. So a lot of our policy work in the past has been around wage equity, making sure that everyone has some income equality there. And then also engaging men and boys is where I specialize. So we're currently working with, the fatherhood community. Ohio has a very vibrant fatherhood community with the Ohio Commission on Fatherhood, as well as working on different mentoring and reentry programs, making sure things like healthy masculinity, gender norms are incorporated there. And I'll share a little bit more about that here in just one second.
So let's hop to the next slide. And we also want to point out, while we appreciate very much that this is focused on prevention, the better efforts are trying to make sure that violence does not happen. A lot of the alignment that occurs, however, with the work that ODVN does, because we work with survivors of intimate partner violence, domestic violence, teen dating violence, a lot of the alignment occurs in that secondary and tertiary and intervention space as well. So one of the things that we wanted to point out was a report that we did a few years ago called Seeking Safety, Equity, and Justice, which was the result of surveys and focus groups conducted with survivors that were served by some of the 76 ODVN member programs across the state, and their experiences working with a lot of the groups and the systems that the HPIO brief points out. There's a ton of good data on ODVN's website, some of the background resources, one-pagers around different topics and issues are all there that help kind of fill in the pictures of how this happens, how violence is experienced and dealt with, particularly in terms when it's within the family and within the home. So let's pop to the next one. The other thing we kind of wanted to point out, because the HPIO brief definitely deals with income inequality and how that impacts safeties within homes and within communities, as Glenn said, the work that has been done in previous iterations of Delta has dealt with wage equity. But 2 years ago, Ohio, through ODJFS and their Office of Child Support, specifically wrote a federal demonstration grant, and we're fortunate enough to be one of the 14 states in the nation that received it, called SAVES, Safe Access for Victims' Economic Security, because we know, particularly in female-headed households, one of the most important drivers we have to raise families and children out of poverty is child support. But safety is a primary concern for DV victims when you have to share your address, when it gets used across ODJFS systems, when the information you give child support also goes to TANF programs, maybe in child welfare, protecting that information, particularly people's locations, can be paramount. The other thing that's important to know in terms of the way Ohio processes and manages child support is no financial orders, no orders that actually provide monetary support for children happen without also making orders around medical insurance. So if one parent is employed or has access to insurance, the orders, when we put together child support, make sure that that is provided as well. So I know the brief talks in part about health access and those kind of issues, and that is a part of what we're looking at and trying to raise in the work that we're doing through the SAVES work with the Office of Child Support. Next slide.
So a lot of the work that I focus on around engaging men is all around changing the social norms, healthy masculinity that we find in our cultures and our societies. So using the socio-ecological model at the societal and community level, we designed the Know Better, Do Better, Be Better campaign. This campaign comes from a quote from Maya Angelou when she said, I did then what I knew how to do. Now that I know better, I do better. So this education is all around healthy masculinity, engaging young men, making sure they are clear and understand the knowledge, attitudes, beliefs, and behaviors that we know lead to violence. Once they know that, we expect you to do better in your everyday life so that we can all be better in our lives, homes, and communities. An example of some of the education, for example, especially in urban communities, we'll go and we'll have a conversation with young men around like the t-shirt, the undershirt that they often wear, and we'll say, hey, what do you guys call that? Obviously, oftentimes the response you get is wife beater. And then having a conversation of why are we normalizing that communication? Why are we calling a t-shirt that? And then how does that affect, the next generation of young people when we normalize that type of violent language, right? In addition to that, we use what we call a dosage model, understanding that not all men and boys are ready for a, say, 12-hour training around healthy masculinity and gender norms, right? So we try to do very light touches around with the social media campaign, the Know Better, Do Better, Be Better. A step up from there and a little bit more engagement is a series we call Courageous Conversations that I'll talk about a little bit in just 1 second. And then ultimately on the far right, you'll see the new playbook, which is a 14-hour curriculum that men and boys or communities can take. And it takes them all through a violence prevention curriculum around healthy masculinity, gender norms, and all the different isms we see. So it also talks about racism and ableism and all those different isms that cause violence oftentimes in our communities. If you'll go to the next slide. This here is the feature of our quarterly series we call Courageous Conversations. We're currently in the process of taking the show on the road, so we're looking to have some very specific conversations in smaller communities. So if your community is interested in having a courageous conversation around masculinity and how it intersects with one of the different aspects in your community. So we've done conversations around masculinity athletics. We've done conversations around masculinity and men's health. We've done conversations around masculinity and religion, and how all those things intersect and play out to how our young men are performing their masculinity. We'll go to the next slide. We do have one community partner we definitely want to highlight, and this is New Directions out of Knox County. New Directions has been working with us for the past 12 years now. In addition to the programming we just mentioned, the wage equity work and the engaging men work, New Directions also offers a full gamut of work that they do in their community that focuses around alcohol. So if you'll go to the next slide, I'll share some of that alcohol work with you guys.
And actually, Glenn, can I hop in because I saw a question in the chat about whether we do these courageous conversations in high schools? And actually, it's a lot of ODVN's member programs that do high school setting kind of work. What we do when we do the courageous conversations and some of the other work is usually focused at community colleges.
However, yes, there's an opportunity to do some things at the high school level. So we have local partners in all communities. So we'll work with the local partner. The benefit there is so that you guys have a local resource in addition to us at the state. But yes, that is definitely an opportunity at the very end. I'll make sure everyone has our contact information, can reach out to us about getting into your communities. Some of the alcohol related work that we're doing in Knox County, three-pronged approach. First is the community policy work. So making sure there's policies in place in the community around alcohol serving. It's a lot of education with bar owners, things of that nature, so that they're serving in a safe capacity. The second step is parent education. Parent education revolves around making sure parents are aware and knowledgeable the different ways kids may try to hide or conceal some of those behaviors, especially when it pertains around alcohol and other substances. And then the last is some community education in this process that we call, askable adults, making sure adults are someone that young people can go and talk to, have conversations with, and engage with when they see problematic behaviors in the community. You can go to the next slide. This is an example of one of the billboards they use in Knox County to help share some of that education around alcohol and engaging parents. Another thing that they offer is what they call a teen advisory council. So you'll see that collection of young people, and thus using young people as leaders to communicate and do some of this work. Peer-to-peer education we find to be very, very effective. Oftentimes us seasoned folks go in and the young folks don't really want to listen to us. So finding those peer leaders that can do some of that education and work at the community level is always extremely beneficial.
So if we can hop to the next slide, that kind of gives you an overview of the work we do. And we do it with what we call our SLT, a state leadership team, folks from a host of different agencies, so that we're not just looking at intimate partner violence prevention, but child abuse, elder abuse, sexual violence, firearm violence, suicide prevention, all of those kind of things. And when we do that, we know we all talk in jargon. And while I know a lot of the good folks at HPIO have backgrounds in statistics and those kind of things, some of the rest of us are not necessarily the numbers folks. So one of the groups we've worked with is an organization called We All Count that does a lot of training around improving data literacy and centering data equity and helping people understand the numbers that they're seeing. So this was a reference or a resource that we wanted to make sure we shared with people. And we'll put a handful of links in the chat when we're done so that people can access those things. But that is something we realized as we're doing the work and talking both within communities and even within state organizations, is that folks, sometimes even when they get the numbers, they don't understand what the data is and isn't telling them. So this was an organization we found that did a ton of good work around that area. Another thing we're doing to use this in is looking at what resources are there. So some of these questions that have come up about what should have more funding. In order to figure out kind of what needs more, we need to figure out what's really being done and where. So we're in the process of putting together a resource inventory. I won't be able to give you a link to it yet because we're still working on it, but we are trying to figure out what agencies in the community are doing what types of program, particularly if it's evidence-based prevention programming, so that we can map that out so that folks can work together. We were having a great conversation with Damien before we started the webinar so many times. And again, I know I'm talking to folks who write and work in grants. You're looking at not duplicating service, but the reality is it's not duplication. It's about enhancing capacity and increasing collaboration across agencies that do this work so that we can work better together. So we also wanted to let you, if we can hop to the next slide, give you a little idea of some of the intervention work and services that ODVN does that touch on the topics that are raised in this particular brief. We're doing a lot of work around health advocacy and health equity and access to care. And we have projects, mobile advocates, clinical experts on a directory that we can refer people to make sure that survivors and people who've experienced violence can meet local resources to get their needs met in that space. We've got a relocation program, a hotel program, a rapid rehousing program through HUD, because as the brief talks about, there's so many issues dealing with affordable housing and working with those kind of folks to make sure that survivors get connected. Because things, once you add violence into the mix, things become so much more complex. And we need to make sure the folks who are providing these services understand the safety concerns as well. We also, to get to the underlying issue, have an Impact for Change bulletin, a DEI group, and work being done there, because we can't talk about the drivers of inequity without looking at the social determinants of health and racism and all of the issues, all the isms, as Glenn said, that go together that we need to kind of look at together to address these topics. So if we can hop to the next slide.
So here's our contact information and a link to our website. I just want to make sure everyone is able to get to our website, Ohio Domestic Violence Network, so odvn.org. Under where you see Resource Center, you can find reports and facts for some of the reports that we just shared with you guys. Under our work, you can find our prevention tab, find some of our programming. As I mentioned, the Know Better, Do Better campaign. I also mentioned the new playbook. So under the Our Work tab, you can find some of that information. Please copy down Lisa and I's email information. So if anyone would like to reach out and potentially partner, bring some of this programming to your particular community, we are always, always interested in doing so.
So if we can go to the next slide, we just wanted to give you a little bit of an idea. Oh, actually, if we go back, there's the one. Some of the resources, because I also know it makes my heart happy when I use HPIO work with all the stats and the numbers and the research. And we wanted to share some of what we have, because we have fact sheets, we have DV counts from NNEDV, which compares states on similar metrics. Some of the need assessments that we've done, the needs assessments come from that Safety, Equity, and Justice report, different projects and types of information that have been generated in prior iterations of Delta around all of the kind of topics that are addressed in the brief, and also the fatality report. And if I can take a minute to invite folks, our next Domestic Violence Awareness Month is in October. And so our next annual Domestic Violence Awareness Month event is October 9th. It's a press conference at 10 o'clock in the morning at the State House in the atrium, where we release the annual fatality report, DV-related homicides, which again ties all of these kinds of issues and topics that we're working with together. And that's actually our ultimate goal. How can we take everything we're doing programmatically and in prevention to figure out how to reduce the homicides we're seeing? So with that, I think we're wrapped up. If you want to go to the final slide, it gives you some more contact information for us. And we're happy to answer any questions. We're trying to double check the question and answer section and the chats if anyone has any.
I did see a question from Celia in asking about our resources offered in Spanish. I will share with you that the Know Better, Do Better, Be Better campaign, we do have translated into Spanish. The full curriculum is not translated into Spanish, but I think that's a situation where we could very easily partner with a local organization and they can help with some of the translation and communications as we engage community.
Okay, and we've also got a question. How do we encourage folks to report violence? Reports are lacking since folks are afraid to even report it. So I think the question becomes the word encourage. That's what it hangs on, because I would say we're not honestly working on encouraging people. We're working on understanding where that fear comes from and what people can do to address that fear and become safe, so that they're in a position where they can report without fear of repercussions from that, if that hopefully make sense. It's sometimes those fears are well-founded, and reporting and coming forward isn't the best choice for a survivor for a host of reasons. So a lot of, and folks are afraid to call the police. That's why we brought up the Safety, Equity, and Justice report, because it gets into those issues of what populations in particular have more reasons and express more fear, and what experiences have been. So yes, that's why we're doing the DEI work we're doing, but that would be a good report to take a look at there.
And I think that also lends to why it's so important to, lift up names like Sonia Massey when situations like that occur, so folks understand where that fear comes from. I mean, there's an individual who called police to her home and unfortunately lost her life. So yeah, there's a huge fear, very community specific, and unfortunately, communities of color tend to have that fear great more.
Yeah, and the report breaks that out in a fair amount of detail, because it's also LGBT communities, all of that. And do we work with the police departments? It's usually on the state level. We're working with more the larger organizations, OPATA and the Buckeye State Sheriff's Association, and we support and provide training and technical assistance. And as our programs, we've got 76 member programs around the state, and as they're working with specific law enforcement entities, we can help them do that. But one of the things we are working on in response to the fatality report and exactly this kind of information is doing a training for law enforcement. It's a bit of a process to work through OPATA, but we're working on that.
And we've done some of that around the engaging men side, engaging some of the specific police departments. We've done some with very campus specific police departments and some more community specific police departments, really around healthy masculinity, gender norms, and understanding some of the dynamics of power and control, especially when someone puts a badge on. So yes, we've done some of that work.
And we're willing to partner. It's not, you don't have to be a member program. We're willing to partner. If other folks have a project or something they're working on, we are happy to help.
Tony, we're going to pass it back to you. It is at our time, 12:09. I will keep an eye on the questions and respond in the Q&A. Thank you.
Thank you so much, Glenn and Lisa. So much valuable information. I'll just say I encourage everybody, maybe take a deep breath. I know this is really hard work and really challenging work to be in and to hear about in the midst of living in a traumatic world. So take a breath, take care of yourselves, and then we're going to go into hearing from Damien Calvert from the Lorain County Urban League. Damien is the outreach supervisor and a violence interrupter from the Lorain County Urban League Saving Our Streets program, and he brings a wealth of knowledge on violence prevention, and we're so thankful to have him here to hear from him as well. So I'll turn it over to you, Damien.
Okay. Hey, how everybody doing? My camera is not cutting on. Does my camera cut on? Start my video.
Oh, there you are. We see you now.
Oh, okay. Can everybody hear me?
Yep.
Okay, great. Good afternoon, everybody. First of all, I just want to thank Lisa, Glenn, and Tony for y'all great presentations and for the slides that you've shown, which will give gives a lot of context to what I'm going to be sharing. Mine is going to be more conversative, just sharing with you with the work that we're doing and why we're doing it. And then at the end, we'll have a brief little slide that'll show the SOS team and some pictures of us in action and some of the things that we do. So first, let me start with about a decade ago, violence was reframed as a public health crisis. And this was very important to us because as a public health crisis, it informs how we show up in the work, because traditionally it was treated as violence happens in a vacuum. And then how you show up to the work, crime is committed, violence is done, police show up, wants to make an arrest, and they only investigate insofar as defined to establish a motive, identify a suspect, and arrest them. But here under the public health model, the question arises, why is violence happening? And this here, with all these great slides you've seen in the information, we begin to look at not only the social and cultural drivers behind violence, but then we really get to take a deep dive into understanding, like, why are these things happening? So, for example, before I even go into the work that we're doing, I want to just share with you something briefly. When I was incarcerated, I remember reading this great story about Jeffrey Canada and the work he was doing in the Harlem Renaissance Zone. And they were working with children, helping to get their education, but recognized that they can't pour into a child and get them into a transitional way of thinking, changing their normative behavior without working with the primary care provider, the mom, the aunt, the grandmother, or whoever, right, who was taking care of the child. And they really started taking this holistic approach. And this was the first time that I ever heard of the correlation between illiteracy and incarceration, and illiteracy in third grade, and how they use third grade literacy scores to base how many beds to build in prisons when they project to turn 18. This blew my mind. And this is at a time when I was just being familiar with the term that eldermen of the Children's Defense Fund coined, called the cradle to the school prison pipeline. And all of a sudden, this pattern emerged, and this intersectionality, even how I got caught up, right? And so this was the first time that I really began to see, like, these things don't happen in silos. These things don't happen in vacuums. Like, they're connected. And then it set me on a quest to, like, understand how I ended up in that place. And I kept asking this question, who am I? And while asking this question, who am I realized I had to also answer the question, how I came to be. And that how I came to be was a walk back, an examination of the events, the happenings, the trauma points in my life that weaponized me and that sired out of that these thinking patterns. This began to inform my evolution in there. This began to inform my interest in this time, in this kind of work, that when I got out, I began to wonder, like, why these things are happening. So when I was doing reentry focused type work, and I started doing work at Case Western Reserve, and I started understanding trauma and how traumas transfer epigenetically. And this began to really revolutionize how I showed up in the space. So under this public health model, there's a trauma-informed approach. And this is so super important because hurt people hurt people. So when we're working, for instance, with these young souls, now we begin to understand, why was the illiteracy score so high in third grade? This become an examination, for example, of lead poisoning. Cleveland, for example, is the third highest nation for lead poisonings in the nation. It's the third highest city in the nation for lead poisoning. So now we begin to understand the cognitive developmental delays that was driving a lot of these illiteracy scores. And then on top of that, inside the prisons, there was, of the ODRC, there's 85% illiteracy rate. Now we begin to understand, and now I began to kind of like understand these social drivers and the like. So when this new framing as a public health crisis began to take place, it informed the work, particularly under the trauma piece, because even in the African-American community, we still have echoes of slavery. So when we understand trauma being transferred epigenetically, we begin to see how them things begin to play out. That's a conversation in of itself. But in the framing of this violence, or shall I say the creation of this violence interruption model here in Lorraine, we had this great opportunity to take a prevention focused approach, because violence interruption, you have prevention, intervention, and redirection. Under this prevention focused piece, this allowed us to really build collaborative partnerships with schools, to build collaborative partnerships with parole and probation, juvenile parole and probation. This allowed us to invest in a strong outreach emphasis, because we want to catch our youth before they commit acts of violence. So we have to be there in the schools. We have to be there helping to build what we call the community of support around the young souls that we're working with, the youths and the young adults. And so what we understood from the trauma, through the trauma lens, is that when we're dealing with youth, we've realized that trauma inhibits the ability for the brain to process future orientation. So a lot of the youth who's committing these acts of violences, they can't see themselves beyond the urgency of their situation. They can't, you ask them, like, where do you see yourself in a year from now? And they'll tell you, I don't even know where I'm gonna be at tomorrow or next week. Again, this really informs like how we showed up. And this is why under this violence interruption model, as we practice it, there's a heavy emphasis on credible messengers. And credible messengers are people with those lived experiences that have some type of standing and the credibility in the community, so that if violence happens, they can like go out there to those bad actors and interrupt it. But we also recognize that having the lived experiences alone is not enough. You have to also understand, like, as a credible messenger, and you was going through your challenge, whatever that challenge might have been, through incarceration, through addiction, whatever, what was your theory of change? How did you live that theory of change? What is your new code of life? How do you live your code of life? How do you unpack those values to the people that you will be working with? Toward that end, in the selection, the vetting, and the training of the team that we have, which is a team of 5, and we're looking at onboarding one more person. It's a small team, but it's concentrated and it's very atomic. And in this team, not only are we doing with the prevention and ready to do any type of intervention type of work, we're also doing outreach work. So we had to learn the fundamentals of organizing science, because there's an organizing component to this. We recognize that you tell stories. We all tell stories in the way we live our lives. What's your story? How do you unpack your story, your change, the things that you've been through, the challenges you faced, and how you rose to those challenges? How do you unpack that when you share not only what you do, but why you do it? And in the sharing of the why you do it, your code of life is revealed. And it just helps establish rapport to the young souls and the young adults that we're working with. Because as the saying goes, only those of us who've been bitten by the snake can tell each other how it feels. So part of what we do when we're doing outreach, because we don't wait for violence to happen, we're out there in the community. For example, today at 3 o'clock, we'll be doing a community cleanup in Lorraine. These community cleanups allows us to help clean up that highly identified impacted area where there's identifies a lot of activity going on. Not only does it allow us to get in there, unpack who we are and why we are, and through the cleaning of that, there's symbolic import in that, of like helping to clean out the bad elements of that community. We get to unpack our stories. We unpack who we are as serving our street team members, who we are as the young men and well, I ain't young no more, but as the men and the women in the space, like, and share our whys with doing it. And it helps us connect more to the people, and it helps establish rapport and build trust. Another example was just this past weekend, we did a block party in another area of Elyria that was highly impacted, that we've been in for the last, we've been in there over the summer. We went in there, did a community cleanup. We built relationships. We established our ministry of presence. We went in there and checked in on the people that we were building relationships with. We helped service some of their needs. We got familiar with the parents and some of the youth there. Then we came back for a block party and partnered with other people in the space, Horizon Daycare, the people who own that housing area. And we was able to just kind of like give back to the community, deepen those relationships, refresh other relationships, and start new relationships. That's all part of the work. And also each one of our SOS team members have developed their own program. So we have a program, for example, one of our team members, Walter, who has a mindfulness program, because in that trauma approach, we recognize that we're dealing with a hyper aroused population. So that mindfulness techniques help in the de-escalation. It helps help lower those cortisol levels and adrenaline when they're in these hyper aroused state, help them to be more present in their life and more aware of the options that they have. Another one of our team members, Sierra, has a healthy relationships, because as was mentioned in one of the other PowerPoints, domestic violence. domestic violence is really rising amongst the teenagers that we're dealing with now, particularly of a lot of young ladies quick to put their hands on their partners. So in that healthy relationship building, not just as it relates to relationships between young men and young ladies or people in relationships in general, but it also deals with relationships, healthy relationships with your peers and associates as it relates to not allowing yourself to get trapped in negative peer influence and peer pressures. Like these is all facets and domains of the work that we have to do. That's why we also call ourselves human justice ambassadors, because a lot of this work that we do is helping to build them up, helping to resolve conflicts, helping to build relationships, helping to build healthy self-concepts. So this collaborative element in the space with other agencies that have that capacity to serve also, and it's just super important in creating that community of support around all our youth. And then also we deal with a lot of what we call narrative harvesting. And I believe this was spoke on in one of the things where, how we describe ourselves, what we deal with, particularly with a lot of the young men, is they describe themselves as savages and as beasts. I'm a savage, I'm a beast. Well, when you take on that label, you act that part. Number one, you act beastly and you act savagely. And then on top of that, how you define and describe yourself drives other people's experience of you. And from a reentry, when we're dealing with a lot of young men who have been referred to us out of juvenile courts and they're coming home from a period of incarceration, this becomes super important. Because if they identify a label as the label, so for instance, if I identify myself as an ex-con or an ex-felon, you relate to the label, not the human being, not the journey, not the evolution. So this again is all within the ecosystem of violence prevention, interruption, redirection. The redirection piece is to focus on the programming that help change the normative thinking and change the norms of these young ladies and men that we're working with. And so part of helping them to build power and agency within themselves is also helping them to understand what the gears of impressions are that's holding them back and how to navigate those different things. And so we've been having great time in the programs that we've been helping to bring into the different communities, the relationships that we're enjoying, the referrals that's building up the ranks of our mentees. It's really been life altering. And as we always say, this type of work is it's a lifestyle. It's an extension of who you are and why you are. And so it has unconventional hours, right? It's not a 9 to 5. You're going to get those calls late at night, things like that. And so finally, just kind of like summarizing everything, there's so many different components to violence interruption, to prevention, to redirection. Like to be impactful, you have to be all of those things, and you kind of like are doing them simultaneously. So the work is rewarding. The work is necessary. It's a privilege that this work is housed with the Urban League that has a historical and local and national footprint in the community of addressing disparities. And because when we're dealing with this work and you framing it properly, understanding that violence doesn't happen in a vacuum, we understand that a lot of this is disparity driven. I believe Mother Teresa said that the worst form of violence is poverty. Poverty is the worst form of violence. And so in addressing these inequities, we have a lot of in-house services here in the Urban League within ourselves that's housed within our house that we can help with. That helps with working with our mentees and the like. So I'm going to ask if you would please show our PowerPoint real quick. This is just a couple minute PowerPoint to kind of give an overview of what we do. And I hope they can hear the little music in the background.
Damien, do you see the slide where it has your president and CEO?
I sure do,
Okay,
Miss
let me
Paris
know.
Smith.
Yeah, let me know when you'd like to move to the next slide. Thank you.
Okay, it should play all the way through. If not, move to the next slide, please. And this here is our team. As you see, Angela Lee, our program manager, she does a lot of work behind the scenes. That bald-headed, light-skinned gentleman, that's me. Then you see Walter Atwood and Sierra Dillard and Kervin Menendez and William Kirkendall. And we're looking to onboard 2 more people as we speak, so that we'll have more bandwidth and more reach in the communities. Next slide, please. So as you see, Serving Our Streets' initiative aims to reduce violence using disease control and behavioral change methods. Our approach is detect and interrupt potentially violent situations, identify and change the thinking and behavior of the highest risk transmitters, change group norms that support and perpetuate the use of violence. SOS is guided by a clear understanding that violence is a public health issue. As a community, we must work to stop the mental health epidemic of violent crimes that has been spreading and infecting our youth/young adults throughout our community. So some of the things that I shared with you priorly, this is where we're operating up under. Next slide, please. This here is a flow chart. So this here shows like how our client is referred, which a client may be referred by the courts, parole, probation, parent, guardian, school, or third-party program. As of lately, we've been getting walk-ins because people have been hearing about the work that we're doing. Once we get the referral, we contact the client. That client is contacted by one of our team members to set an appointment for intake and assessment. When the client comes in, a consent form is signed, needs assessment conducted, action plan formulated based on those needs, internal and external referrals established to provide services and resources to meet clients' needs. This becomes super important for those collaborative partnerships that we talked about, everybody. Number 4, orientation. We introduced to the SOS team, outline expectations of mentors and mentees, and introduce to soft skills. Client creates a vision and a mission statement for their lives. Orientation is held on the first and third Thursday of the month. We can kind of tweak that. And then we follow up. The mentors immediately follow up with client. We serve as the client's accountability coach to help them follow through with their action plan. Mentor will connect with mentees twice a week via phone, text, and or in person. Sometimes it's more than that, depending on need. Often also when we go to events, we invite our mentees with us. Next slide, please.
Damien, thank you so much. We are at the end of our time for our webinar today. We are so grateful for all the information you presented, for all of our speakers today. Thank you all so much. Jasmine, if you could head to the end of our deck.
Dang.
Perfect. Damien, it was such good information. Thank you for everything that you shared. All right, team. We are gonna head into our poll questions now. We'd love for you to answer some questions for us. We hope that this work is helpful to you, that this information is helpful to you as you work to influence policy change and improve health and well-being in our state, either as a private citizen or as a member of your organization. Will you please respond to the poll questions here about that and about the quality of today's webinar? We really appreciate your feedback. We're always looking to do an excellent job in providing you guys the information that you need.
And I'll add that, Damien, Damien's slides will be available to everyone, so you can see the rest of the detail that he was giving about his program. But I also see folks already saying they're excited to connect with you, Damien, and also with ODVN. All of you have such great work. We really appreciate it.
If you could put their information in there so that they have our information on the Urban League, the ways to contact us and stuff like that, I would greatly appreciate it.
Absolutely. We'll make sure it's posted on our events page.
Thank you.
Thank you. All right. Well, as the poll stays up, we'll move to the next slide. Just ways that you can contact HPIO. This is the events page where all that information will be posted. That'll be available likely by the end of the day today. This is how you can find me and Tony. as you need us. And then the last slide has ways that you could connect with us otherwise via our email list, etc. I'm hearing that all the content you need is already on our events page, so feel free to head there. Thank you so much for spending the last hour with us. Have a great rest of your day. Appreciate you all.
Thanks, everyone.
So can I say something real quick?
Sure.
So
Yeah.
the way the PowerPoint was,